Today we're going to talk about Duchenne muscular dystrophy and mental health. An illustration by Cassarino, Sofia Kavanaugh, and Dorosk. From birth to around 7 years of age, children with DMD often present mild to no symptoms and can partake in normal childhood activities, but may have slight trouble walking, talking, or sitting up as they progress through this stage. Parents may be able to recognize some of these symptoms around 5 years old, and the diagnosis of DMD can have a significant impact on their mental health when they realize the grim outlook of this disease and the lack of effective treatments available for their child. Around ages 6 to 10, a DMD patient will have an abnormal gait, trouble with everyday movements such as walking or going upstairs, and will perform the Gowers maneuver to get up off the ground. This stage can be particularly heartbreaking for both the parents and the child, because not being able to keep up with friends and siblings who are the same age or even younger than the child is very disheartening at a stage in life when running around and playing is natural. The parents are also aware that the disease will continue to progress and are forced to make the difficult decisions of when to tell their child that they will eventually be confined to a wheelchair, or when to let them know that they will inevitably have a shorter life than most people. Ages 10 to 14 is around the time when untreated DMD patients fully lose ambulation, can develop scoliosis, and may have trouble bringing their arms up to their face. Parents are more accustomed to the disease by this point, but it can be a struggle that they are more than willing to undertake to help their child move around with a motorized wheelchair. However, the child may feel ostracized at school and in public because their condition is more evident than it was previously. DMD patients can even feel isolated from their closest friends because they will never be able to understand how it feels to have this condition. This is significant because at this stage in life, children often want nothing more than to fit in with their peers. Ages 15 and older, lung and heart monitoring is necessary, and sometimes breathing devices are essential since the breathing muscles may become too weak to sustain normal breathing. In untreated patients, death usually occurs in the late 20s or early 30s. With modern treatments, this entire timeline is delayed, and some DMD patients are able to go to college and live on their own, leading fulfilling lives despite the adversity they face. Some DMD patients can also partake in activities they enjoy, such as being outdoors or even acting. This being said, there are serious negative effects on mental health which need to be treated along with the physical aspects of the disease to improve the quality of life of DMD patients.
So what is it like to actually live with DMD? We're going to look at a blog by Charlie's Fund called A Day in the Life. When this blog started, Charlie was still able to run, jump, and play much like his other friends. However, if you knew where to look, there were many signs of his disease, DMD. Part of these signs included him using his hands to get up from a chair or from any position on the ground, showing extra strain from his upper body to compensate for the lack of force in his lower body, as well as needing an extra push to get into a car or into his bed. If you look at him closely, he seems to have muscular clasps, but it's actually inflammation and scar tissue causing this appearance. Because of this, he also needs stretching for 15 to 20 minutes twice a day, and depending on who might be around him at that time, it can be his parents, his physical therapist, or even his teachers at school. He also goes to a physical therapist and a speech therapist. The speech therapist helps him with word formation and sentence retention, while his physical therapist attempts to help him retain upper body strength and mobility, such as flexibility and strength. However, with his physical therapy, he still gets very exhausted on trips and walks, and although it is very good for him to go out with the family and enjoy, sometimes the challenge presents in that he needs help to get back to the car, often resulting in being carried or another additional assistance to get back to where they originally started. In terms of medication, Charlie takes 6 different medications and supplements formulated by his physicians and nutritionists to help retain muscle formation and delay his decay in muscle. He also takes a muscle shake. There's also several things that are now off the table because of Charlie's condition, such as pizza, burgers, hot dogs, fish sticks, and other foods that are high in fat, sugar, and sodium. Although these are all fun foods, they're now no longer an option or only reserved for special occasions. And this is because the medications Charlie is on, the steroids, make him very prone to weight gain, which results in a need for a low sodium, low sugar, and low fat diet. The last part of his day, is that he often has to wear Spider-Man boots, which is a fun way that his family has begun to call the braces he has to wear each night to help delay contractures. This is all a lot for a small child to bear. It can take tolls on his physical health, on his mental health, as well as his general well-being, and it's often very hard to keep up this rigorous routine. With his parents being his primary caregivers, it can also be very hard for them in their mental health. Now, Charlie is actually living in a studio apartment all by himself, which presents its own perks and challenges, and he does this while attending college virtually since the COVID-19 pandemic. He's using a wheelchair now, as expected for most patients with DMD, but he finds joy in finding accessibility in new things, such as setting up Alexa, or other options that have made his life just a bit easier over time.
Let's talk about the specific research that's been done on DMD patients and mental health. Research has shown that people with DMD suffer from more neuropsychiatric problems than the general population. One factor to consider is the hardship of accepting not only an early death, but a fairly low quality of life in the years leading up to that, and specifically the limitations that these kids face due to their prognosis. Another important factor is the actual genetic link between psychiatric disorders and a mutation in the dystrophin gene. In terms of mental health issues due to prognosis, one study found higher rates of internalization problems in the general population. They used a questionnaire that was filled out by parents of children with DMD, which was later analyzed for rates of internalization problems, which was measured by several factors: withdrawal, somatic complaints, and anxiety and depression scales. They also examined externalization problems. 23.4% had internalization problems, which was significantly higher than the prevalence in the general population, measured by another study. Another study also examined symptoms of withdrawal, feelings of depression, and isolation. They found a 52% prevalence rate of psychiatric disorders in boys with DMD, and that this occurred mostly as these boys got older. Now let's examine the actual link between mental health disorders and the genetic dystrophin mutation, unrelated to the worsened mental health issues that arise from facing their prognosis. In one study, DMD patients were shown to have a higher incidence of obsessive-compulsive disorder than in the normal population. 4.8% had OCD. Other various studies have shown that there's a link between neuropsychiatric problems and the mutation on the dystrophin gene, specifically with anxiety disorders. In these studies, in combination with many others, various researchers reached the same conclusion. Evidence points to the fact that DMD is not just a neuromuscular disease, that it actually affects the neuropsychiatry of these patients as well. This is due to two factors: the dealing with the prognosis and its implications, and the actual link that exists between the mutation in the dystrophin gene and mental health.